The next panel is on vital statistics and innovation in healthcare. And Amit, come on stage. So he's the COO of Lertly, a technology built for seniors to live safely at home. You're from Washington, D.C., and interesting fact about Amit, this is quite fun. He's worked for every single Internet 1.0 brand, AOL, ICQ, WinApp, Netscape. And you've served over 1 billion users as a part of that world. Great, so over to you in innovation in healthcare. Not working.
I will speak loudly. Oh, there you go.
There we go.
All right, I would like to invite to the stage my fellow panelists. I got Rabin Yakubi. Rabin used to be with DoubleClick and Google and other such companies, but today he is a chief commercial officer for Babylon. Rabin. Then Patrick Watt, who is corporate director of Bupa. And Laurent Morlet, hopefully I'm pronouncing the name correctly, who is the digital innovation lead at Johnson & Johnson Innovations. That's our panel for this morning. Wow, okay. So, we're going to talk about innovation in healthcare. And just so people know, healthcare is the #1 industry in the world. It's about 3 times as big as banking. It's somewhere between $8 to $9 trillion. So that's big, even in my standards. And there, only in the past recent years, we've started to see some disruption and innovation in the world of healthcare and digital. And I'm always thinking to myself, I'm from the world of technology, and if healthcare would evolve as fast as hardware or software, we'd all be living for 200 years, never being sick at a cost of $10 a year. So we're not quite there yet, but we'll talk a little bit about that. I'll go here. Maybe we'll start with a few kind of general questions to the folks here about what they're doing, and then we'll go deeper. So, Rabin, tell us, what is Babylon?
Sure. Hi, everyone. Good morning. Babylon is a mobile personal healthcare service. So we combine mobile technology, artificial intelligence, and our own group of general practitioners and specialists to do everything from text-based Q&A to clinical monitoring and diagnostics, to symptom checking, and ultimately giving you the ability to see a GP or a specialist via voice or video from your actual phone, who then allow you to get your prescriptions. We are UK-based, available in the Google Play and App Store. We have about 125,000 members to date. We also offer Babylon through some of our esteemed friends at Bupa and other insurance companies to corporates as a benefit. We are currently operational in the UK and Ireland, and we are moving into East Africa, starting in Rwanda as of January. And our mission as a business is to do for healthcare what Google did for information, which is to basically make it affordable and accessible to anywhere, to anyone, anywhere, at any time.
So just so I'm clear, if I have Babylon, I can just open up my phone and kind of bring up a doctor and say, hey, doctor, can you see me? I got this zit here. Is there something that we can take care of, and they will write a prescription and take care of it like that?
Absolutely. So that's one part of what we do. So we see ourselves really as an end-to-end solution. So a lot of what you talked about is sort of sick care, which is really intervening when something is wrong. And we can, through a simple tap, book an appointment within an hour with a GP or a specialist and be able to diagnose something like that. We also have specialists across ophthalmology, dermatology, ENT, etc. But we do a lot more than that. So we also focus on the healthcare piece of it, which is to keep you healthy. We have a very sophisticated clinical monitoring tool that captures a lot of data, not just the stuff that a lot of other tools do, like steps and weights, but also your heart, your kidneys, your liver, etc. And by doing so, ensure that we don't just intervene when you're sick, but we also help you maintain a more healthy lifestyle. And the whole idea is that ultimately, especially with the introduction of artificial intelligence, we can go into preventative medicine. So the more information that we can gather through algorithms, we can then actually diagnose things without the use of a doctor and be able to tell you in advance that something is wrong. So an analogy we often use is those of cars. If you think about cars 20 years ago, you wouldn't know anything was wrong until your car was on the side of the motorway. Today, a car is equipped with so many sensors that you know way in advance that something might go wrong and you can take it to a mechanic. There's no reason through all the innovation that happens through mobile devices in particular, if you think about it, a lot of the transformational innovation in mobile is going to be in health. You know, a lot of the incremental stuff we see is in, you know, sort of screen resolution, battery life, you know, processor speeds, but the really transformational stuff at this point is to be able to go in this direction of the phone becoming a sensor to your body. And the more of that we can do, the more we can then alert you in advance that something is about to go wrong. And if that happens, we can then quickly give you access to a doctor through your phone, who then can prescribe to you a medication which you can pick up at your nearest Boots just by geolocating it or having it delivered to your home. So it's really an end-to-end solution. It's not just about intervening when something is wrong with you, but ensuring that you maintain a healthy lifestyle, and we can actually track that.
Patty, so I'm from the US, so I don't want to talk too much about insurance and health insurance specifically, but you're with Bupa.
Yeah.
Maybe a couple words about Bupa and what is it doing in digital and technology?
So possibly many of you know about Bupa. In the UK, we are the #1 health insurer and social care provider. We've been around for about 70 years. In fact, we were founded a year before the National Health Service, and would freely admit that health as a sector has been much slower to respond to digital and to disruption. And I think there's lots of different reasons for that, which I'm sure we'll come across. But principally because healthcare is, by its nature, extremely complex. Delivery of healthcare and the way it's funded in the UK is highly fragmented, both between kind of public and private pay. And actually, I would say we can be criticised for not actually putting the patient or the consumer at the centre of what we're doing. So, you know, Bupa as an organisation has got incredible heritage. We've got experience of running businesses overseas. We are not just based in the UK. We have big businesses based in Australia, New Zealand, Spain, Latin America, Middle East, China, India. So we're continuing to learn from around the world how different people are trying to solve kind of this problem, which is increased consumption, increased demand, and therefore rising costs. And I think to be able to respond to that, we've got to look to digital technologies. We've got to look at new disruptive businesses and rethink actually how we deliver healthcare. So as an organisation who has its heritage based very much in the UK, we are increasingly looking at different business models to reach more people and become much more relevant. It's quite interesting. In the last 10 years, about 1 million people have left the private healthcare marketplace. And that's because they're increasingly seeing private healthcare as less and less relevant. But yet, conversely, if you look at the growth of wellness, and particularly the number of kind of digital businesses and wearable devices, we have seen exponential growth there. And we feel there's a real opportunity for Bupa to play in both those spaces, being there when we know our customers need us most, when they're ill and when they're feeling vulnerable, but also engaging with them in their well-being, whether it be about helping with their nutrition, with their sleep, their mental health, their diet, their fitness, etc. So one of the reasons that we've partnered with Babylon is we see partnerships as being a really good way to harness some of the great innovations that we're seeing in the marketplace.
Thank you. Laurent, you are with a little startup called Johnson & Johnson.
Small company.
And you focus on innovations, which is always a difficult thing to do within a large company. Tell us a little bit how you're trying to foster innovation within Johnson & Johnson.
Yes, absolutely. So Johnson & Johnson is probably the largest healthcare company in the world, and has been around over a century. So effectively, just over 2 years ago, Johnson & Johnson took the bold step of establishing innovation centers in the world in 4 different locations: West Coast, Boston area, London, obviously, where we're based, and Shanghai. And this wasn't done by chance. Effectively, these are recognized hotspots of innovation in the world, and effectively, with the portfolio of medicine of Johnson & Johnson being over 50% from products that were actually not invented in Johnson & Johnson. I think the recognition that a great idea can come from anywhere actually forced us and pushed us to realize that we had to engage with external innovation, that effectively that could help us sustain our growth. And those innovation centers are set up as an operational team that can take collaborations very far and sign collaborations in order to help and work with those external partners to take the solutions and the products forward before eventually they become a full part of the J&J pipeline. So that's really the typical model we're working on. And if I now look a little bit more around the healthcare technology, the digital health, or the solutions of that nature, I think it's a similar approach. Effectively, going forward, we can see that it won't simply be a knee replacement that we put into patients. It won't simply be a drug or a pill that people are taking. We are talking about bringing forward solutions, putting the patient or the consumer at the center of our focus, and effectively bring in all sorts of, we call them wrapping up solutions around a particular product and help the patient through his journey, for example, of a whole knee replacement. And as a result, part of the Innovation Center activities is indeed to look outside for relevant technologies that we could bring as part of the solutions we want to take to the market.
So, but tell me, I mean, in healthcare, so I think last year was a record-breaking year in terms of money raised. I'm word from entrepreneurs and startups. I think there were about more than $4 billion raised in 2014 for digital health startups, et cetera. But it feels that it is extremely difficult to move things forward. Now, I know we're talking about health, I know it's regulated, but why is it so difficult for someone who has an idea to get that from idea to where a person gets value from that? Why is that innovation so difficult in healthcare?
Maybe one part of the answer is, I think, this choice very early on, whether it's going to be something towards lifestyle, helping people to live healthier, where effectively as an app or as a provider of a solution, you're not taking much risk. You're just saying, eat less, run more, drink water, and that is pretty safe to do. I think the minute you're trying to think about moving towards health-related conditions or medical conditions or any kind of diagnosis as Babylon is working into, there's this risk you're taking, this liability you're exposing yourself to if you get it wrong, if you're not 100%. And that means that there's usually rarely a second chance. So you need to get it wrong once. And not to mention how exposed you are to being sued. So you want to touch the diabetic population, you just need to get it wrong, and things go very wrong for you. So from a larger pharmaceutical company, I think we have to be very careful. It's our reputation that would be at stake. And I think for startups who wants to move into that space, once again, quite often the choice will be the safer one, where you're not making huge claims, but then at the result, the end benefit for the patient, the improved outcome or the lower, is challenging. Or if you decide to go for the more medically relevant applications, then it's going to be a long road.
Puri, what are your thoughts? Why is it so challenging? I mean, I understand the concept about risk, but risks exist also in other industries. If you look about, I'm pretty sure that an self-driving car has risk with it, but it's still being developed, and we know it's going to be a fact of life pretty soon. So why is it that it's so extremely difficult in the world of healthcare?
So I think kind of to build on that with two further points, because I do think risk in health is a major barrier to doing things quickly in the marketplace. I think the second thing is that healthcare as a sector is built up over evidence-based interventions. And in a science world, it takes time to understand the impact or the outcome associated with one particular intervention. And what we're effectively saying is actually we want to do things much faster, and therefore our patience and our desire to kind of do things with possibly not the same fact base is quite different to what the medical profession have been used to in the past. To get some drugs through and to get some treatments approved can take years. And technology makes a lot of this happen more instantaneously. So I think there's a very natural tension between where healthcare and medicine has come and where new technologies are trying to push us towards in terms of different ways of working. The second thing I would say is around how data can be integrated. And it becomes more complex when you've got different providers either paying for the care or delivering the care. So the NHS, as a good example, have tried for years and spent billions on developing electronic medical records. And it still sits in that too difficult camp. And I think, what we've got to be careful of is that with new technologies, we don't make the market more complex, more fragmented, and we just have a proliferation of different services. Because ultimately what the consumer wants and what the patient want is that care provider to look at their medical records and make an informed judgment about what's right for them. And the best way to do that is to have that all available in a central source. When you're dealing with multiple care providers or multiple health providers, the ability to actually have all that data in one place is really difficult. And I think that is a very natural barrier to how we move this agenda forward.
But you bring a good point. So yeah, we all understand the risks involved with people's lives. But when you talk about medical records, not many people die from a piece of paper not written correctly. And yet, I went to a doctor last week. It's in the States, but still, the amount of paperwork and I'm talking about paperwork, not an iPad, not a phone, paperwork in triplicates. They didn't have a carbon copy like they used to, but it was amazing. And we are in 2015. So why we cannot see any better breakthroughs or innovations in the world of paperwork? Why is that blocked? Is it the insurance companies? Is it something else that is blocking it? What is it?
I think, just to sort of take a step back, I think risk aversion is one key part of it. I think the fragmentation of the industry is another one. The regulation of the high level of regulation in healthcare is another one that's hindered transformation. With respect to clinical records, and that being on paper, or we sent, there's a company that sent faxes to pharmacies to get your prescription. I think a lot of that has to do that is very systematic to the healthcare service, in that it's still run in a very anachronistic way. Yes. And the reason that it hasn't changed very quickly, and that as a startup looking to disrupt it, if I compare it to, you mentioned Google, DoubleClick, and some of the industries that I worked in the past. When Jeff Bezos started Amazon, he didn't have to go to Walmart and say, "Hey, do you guys mind if I start a retail business?" When the Google guys or the Facebook guys started their companies, or they didn't have to go to all the media companies and say, "Do you guys mind if I distribute and monetize your content?" My impression is that in healthcare, it's very different, because it's very challenging to disrupt without working very closely with the existing infrastructure and incumbents. So people like the NHS, the insurance companies, the pharma company, the pharmacies. And because all of those are very large companies that have been around for a long time, that are not run particularly efficiently, and that move slowly, as most corporate organizations and certainly government organizations do, if you add that to the necessity of smaller companies to have to work with them, it just slows everything down incredibly, because you can't really, at least in developed markets, it's very challenging to disrupt independent of them. You have to disrupt in partnership with them. And so you kind of tie to the pace at which they can go to some extent.
So a couple of weeks ago, I saw a TV show that talks about cyber. They had an episode where a hospital was hacked, and the MRI machines and other machines that provide medicine, they're all connected, and some terrorists could go in and change things. And I thought, well, this is nice. This is a very nice fictional TV show. But then I spoke to some friends who are actually in the world of cyber, and said, not only was this not fictional, but the risks are much greater. So the ability of terrorist network to get into your MRI machine and increase it to the point where you will die, or get into a machine that create medications and pills and stuff like that, and change the dose of an aspirin to be, I don't know, poison. This is all stuff that's there. So it feels to me that innovations in terms of changing that world, it's going to be more risky to wait than to not wait. What are you guys' opinion? Do you see any changes in the world of digital healthcare and defense from cyber attacks happening quicker than the regular time that it takes for things to happen in the world of healthcare?
I mean, I think any great innovation always has its positives and negatives, and there's always a chance of hacking anything released. But we don't concern ourselves with those eventualities. I mean, we focus on really using technology to provide much more cost-effective and convenient services to patients, and that's inevitable. I think anything that you consume in the future, whether it's ordering a pizza or ordering a cab or your media, is going to be done through technology, and healthcare is no exception to that. Now, I think there's an element of risk that's sort of cyber crime related, but I don't think that that's not the big picture. The big picture is that you're seeing a lot more information on healthcare growing exponentially. You're seeing access to that information, like any other information, being much easier to anyone in the world. You're seeing the cost of diagnostics going down considerably. So what used to cost a few £1,000s to get a tip-to-toe diagnostics, you can now do much cheaper. And you're also seeing the cost of intervention through things like nanotechnology, synthetic biology, et cetera, go down considerably. So what all these things are pointing at is that, you said the healthcare market is 7 to 9 billion.
Trillion,
sorry. It represents, I think, in the UK, 10% of GDP.
Yes.
In the US, even 20%. So there's an enormous market opportunity there that hasn't been tapped. Now, and that's in the developed world. If you go to places like East Africa, where 50% of the population have no access to healthcare, and it now represents maybe 20% of global healthcare spend, projected to be 50% in the next 20 years, without a lot of the infrastructure that has been holding back a lot of the innovation that we've seen here. So a good parallel is mobile money. If you go to a place like Kenya and you see what M-Pesa has done, 90% of the population gets their wages paid on their phone, and they can go around the corner store and get their chewing gum. And that's because they didn't have all this financial infrastructure that has held back a lot of the innovation. In the UK, you have cabs, you still have to pay them in cash. In the US, you have to sign credit card receipts with a pen. None of that exists. These guys are 10 to 20 years ahead of us when it comes to mobile payments. Now, there's no reason why that shouldn't be the case for digital healthcare as well. In that, in the absence of a lot of that infrastructure, you can actually leapfrog a generation or two of what has happened here and go straight to the patient using technology, because what we all have in common is that we all have one of these. And this is whether you're a farmer in Rwanda or somebody in the city of London, you now have access democratically to information and services.
Freddie, you had to...
Yeah, I was going to say that one thing that technology does give healthcare is accessibility. So one of the biggest barriers in the UK is actually getting to see a doctor, getting to see a GP, or getting to see a consultant. And technology makes that so much easier. But there are associated risks and consequences. What we see once people access healthcare, and it's easy to access, is that they over-access and they over-consume the need to test and to consult. And we create a whole population of the worried well that are constantly monitoring what they're doing. And there are real risks associated with that. As a large healthcare provider, we are really mindful about, having lots of tests and a lot of treatments is not a good thing. So, for healthcare to be accessible, it also has to be relevant to the individual, and that it doesn't drive unnecessary interventions or indeed create worry and anxiety to those that find it much more accessible. And if you look at probably one of the most common questions that we get asked is, well, who's the best consultant? Who's the right kind of pediatrician? Who's the best dermatologist? And if you think about how we've accessed that information in the past, we've relied very much on GPs. And there's been a lot of work around actually, well, how do GPs make that decision? When you go and see your GP and you ask the question, actually, where do you make that referral? It tends to come down to informal social networks or hospital marketing material. Now, if you've got a medical condition, you want to have confidence that whoever's giving you that onward referral is trusted. And therefore, I do think technology enables us to kind of build up behaviors and doctor treatment pathways that can show consistency and ultimately, and we haven't got to this point yet, actually start to demonstrate outcomes. So I think accessibility is great, but I think it's so important that we build a database of relevancy to ensure that the advice that people get is right for them, and that the consultants and doctors that are being referred to are right for them, and that they're not over-treating and over-diagnosing, and that it comes from a trusted source. And again, I think healthcare is somewhat different than other industries, that most people, once they seek advice for their health or for their family's health, want to trust the source, and therefore kind of providing access to lots of untrusted content, again, has challenges.
Laurent, you're in charge of innovation. Do you guys seek out external innovations to bring in? So, I've heard someone say that in the world of healthcare, one needs to focus on one of three things. I've got it here. One is either enhancing the experience of care. Two is bettering the health of populations. I'm guessing better drugs, but and three is reducing the per capita cost of healthcare. So, if there are startups out there what would be the most interesting from a Johnson & Johnson perspective? What would be the stuff that you'd look at in terms of startups out there? What are the things that interest you?
Yes, first of all, it's about patient outcome. So if there's anything that can affect outcome positively, obviously, that is immediately very interesting. And secondly, around cost and whether the overall solution that we are looking at can potentially affect cost. I think something else I'm usually very interested in as well are potentially new technologies, new sensors, new devices that are capable of capturing data that are not necessarily primarily intended for healthcare. And if they are capable of capturing some data that normally we do not have.
Things like that you're talking about?
Well, the next generation of things like that, then it opens up a huge amount of doors as to what we could do for patients with those data, much more precise data, and suddenly we could correlate that to medical conditions. And so that is always very exciting, and it can be something, as I said, not primarily intended for healthcare, but those very better or much better accurate data could almost become, we use this term for biomarkers or things like this. We look into patients when we study drugs or when we treat, and we're thinking about digital biomarkers. So if something can tell me whether today you're limping much less than yesterday or more, and then I can relate that to how effective the treatment you're taking for your knee or for your rheumatoid arthritis, that's very valuable.
Now, is there something that aggregates from the different manufacturers that collect data into one huge kind of database of information? So all the various disparate devices that exist today that collect information about myself and the various sensors, whether it's Apple, whether it's Samsung, Fitbit, whoever, they all collect the data in their own silos and whatever businesses they'll form with that. Is there something in the future where all this data will be aggregated into one big database which is better towards mankind than just for the benefits of the different companies, in your mind?
Yes, absolutely, I think so. I mean, there's one particular collaboration we've done with IBM Watson and Apple, where we are looking indeed at collecting data using the calculation power of IBM Watson and their artificial intelligence. Apple can possibly bring the devices that would actually capture some of that data, and we are, because it's that particular collaboration is in the space of knee replacement, so we are effectively the supplier and managing the care path. So this is an example where you bring all these things together, and I think you can look at it either from the data capture, that gets a lot better, or the artificial intelligence and algorithms that you can build on top of that data, whether you're aggregating it from various data or from one big database, or that I would say is less relevant as long as you can work with that data, and either side or both combined effectively improve outcome.
And I think that's really where the mobile device that you have on you always on the time becomes the center of that repository. Now, I mean, data security, information governance are critical to us. I think they're critical to all of us because we're dealing with very sensitive data. So we invest an enormous amount of resources and teams to ensure that all that data is secure. But what we can do is we basically capture all the data that you have coming from your device, your behavior, your activities, plus then we can combine that with clinical records as well, so we can create sort of a holistic view of all the elements of your sort of medical life, so to say. And that then informs, we also work with Watson and we're developing our own artificial intelligence. That then informs a lot of that artificial intelligence because it's the combination of technology, your own behavior, plus clinicians that do the diagnoses, where you get this 360 view of every patient. And if you put that at an aggregate level and can analyze it, then you can start predicting that something might go wrong. Then you can start using artificial intelligence more effectively, because all that machine learning really is, it doesn't work by machines. It needs human beings and human activity and human intelligence, whether it's you as a patient or a doctor who is diagnosing you, to feed into those machines in order to improve what they can then act on.
I mean, it's interesting that there's this kind of search for more information to understand what health risks are most important to you and all the rest. But if we actually look at this quite differently, you look at something like smoking. Well, we all know that smoking has significant health risks, but actually those that smoke choose to do very little about it or struggle to make the changes. So I think absolutely having access to all this information and data and insight is great. I think the question is, can we use technology to affect behavioral change and actually use things like nudge theory to support people make those lifestyle changes? Because I think there's a danger that we think the panacea here is just more information, more insight in terms of our health. Because there are, and there will continue to be, lots of digital devices that will tell us more and more about our health. The question is, are you going to do anything about it? So I think where there's a real opportunity, and it's something that Bupa are investing heavily in, is about how do we support that behavioral change. So when we get access to all this information that tell us that we should be sleeping more, drinking less, exercising more, eating better, actually what are we going to do about it? And what are the things that technology can do to kind of nudge you along in a more kind of positive direction? And I do think, just picking up on some of the earlier presentations, elements of kind of doing things in communities or in social groups or using gamification is one of the ways I think health could really benefit from learning, and actually saying that people are more likely to stop smoking if they do it in a group. They're more likely to exercise if they do it in a group. They're more likely to adhere to their meds if they do it as part of a group. And actually what technology gives us is a social network, a kind of virtual community by which you can kind of support that behavioral change. Because data in itself is not going to change people's health.
We're about out of time. I just wanted to see if there's any questions from the audience that we can take one or two. Good, okay. And we can wrap it up. Thank you very much, gentlemen, for joining me. And have a great conference for the rest of the day.
Yeah, thank you.